Hello, my name is Dr. Saif Gallagher. I am a plastic and reconstructive surgeon based in Miami who specializes in gender affirmation surgery. So one procedure we're seeing requested a lot more commonly now is a tummy tuck as part of torso masculinization. And so a very typical scenario will be a patient that I've seen, we've done their top surgery, and after top surgery they're able to hit the gym, work out more, and tend to lose a lot of weight, which can result in loose skin around the belly. Now, in some of those patients, they may do okay with just liposuction, but more commonly, if you lose a lot of weight, and it doesn't even sometimes have to be a lot of weight, depending on the type of skin you have, you may need a tummy tuck to get rid of that extra skin. Now, when it comes to masculine identifying folks, the look we want to get is typically different than a classic tummy tuck, let's say for somebody who's feminine identifying. So with a classic tummy tuck, we're trying to cinch in the waist and get that hip to waist ratio, and that's usually not the case for folks who are masculine identifying. So oftentimes there's a few nuances to this. Firstly, we'll tend to prefer to have a more straight up and down look. So usually liposuction is super important around the flanks to get rid of any sort of femme curves that are there, and we'll do that at the same time as the tummy tuck. We want to land the incision nice and low so it's hidden by the belt line, and then sometimes, if it's possible, if the patient is a good candidate, we may do some ab etching as well to try and define the muscles a little bit better. And then also sometimes we'll do a little bit of what we call a Mons lift. So part of bottom surgery, when we're doing a metoidioplasty, when we're using the bottom growth already to be more masculine, one of the typical maneuvers we do down there is to try to bring the growth more forward. And what we'll do is a lift of the pubic area, or a monsplasty, and that can be easily combined in at the same time as a tummy tuck. So in many of our patients, we're sort of bringing the bottom growth forward at the same time as a tummy tuck by bringing that incision down low and getting rid of some of that pubic tissue to bring the anatomy up front and central. So tummy tuck for transmasculine folks, often it's nuanced, it's a little bit more specialized, and it's something sometimes, in some cases, we can combine it with top surgery, but we can certainly do it as a standalone procedure by itself, and we're seeing more and more folks coming back after top surgery to get this procedure.